Good evening, good afternoon, whichever one it is, I don't really know. But hello to everyone. I'm going to attempt to go through this maze of demonstrations, kitchen remedies. And this is the way I was trained. I was trained to be able to go into a person's home and treat them on what's in the house. And it's a really effective way to treat people, where you don't have to totally depend on health food stores or whatever. What's in the yard, or what's in the garden, or what's in the kitchen should be enough to do most of the treatments you need. And now all of these are herbs. The food, everything are herbs. And they all have different properties. And it's a matter of knowing the properties, and then you know how to effectively use them. Now, most of you are quite familiar with some of these things that I'm going to be going through, and it will not be new to you. But knowing how to put them together to make them effective in dealing with problems may be new to some of you. I'm going to just kind of work my way through it, and as I get started, it should come to me. Right now, it's kind of abstract. But right here, this is some pure glycerin, vegetable glycerin. And I talked a little about the vegetable glycerin yesterday. And this can be used in a lot of different ways, but the one thing I really like it for is reducing the pressure of glaucoma. If you have any pressure in the eyes from glaucoma, this is fantastic. Also, if you have dry eyes, a lot of women have hormonal problems where they suffer with dry eye syndrome. This is really good. A person have a lazy tear duct. This works fantastic for a lazy tear duct. Some children may have that. But basically what it is, Alex, I'm going to go through it, and I'm going to go through it kind of briefly. So and I'm going to use some of you to help me because I can go through it much faster when I do that. Now I'm going to give you the measurements and so on. And I may not necessarily use the measurements that I give you because I'm not going to make it up in large quantities. But to make the vegetable glycerin eye drop, I will take probably about a half of a teaspoon of vegetable glycerin. About a half a teaspoon of vegetable glycerin. And this is really a very powerful eye drop. And when you go to a eye specialist, they will not tell you that this is vegetable glycerin, table salt, and spring water. But that's basically all it is. And instead of paying the money for all the other different types of eye drops, this is a much better one. It has no chemicals additives in it. Now I'm going to take about a half a teaspoon of regular table salt. About a half a teaspoon of regular table salt.
With the iodine in it or plain?
It doesn't really matter. It really doesn't matter. And then with the spring water, wow, that is, what is that? That's sparkling water. That's not what I want. Okay, this one here is better. And I don't want that to make an eye drop out of it. Okay. About 4 ounces of this here. And really that's all to it. And you just put that in a little container with an eye drop, and you put about 2 drops twice a day. And it's a fantastic eye drop. It will actually moisten your eyes. The way it works is you have a duct in the corner of your eyes, and it ejects fluid out of that duct. And that duct gets blocked up with fatty deposits, kind of like cholesterol. Cholesterol builds up in your arteries and block your arteries. Well, the same cholesterol builds up in these little tiny capillaries in the corner of your eyes. And it will not let the fluid through. And the fluid have to come through so it moistens your eyes, and that lowers the pressure of the eyes. There's nothing in the vegetable glycerin or the sea salt or the water that will bring your pressure down. But what it will do, it will dissolve the plaque that is built up in the duct, which then will stimulate the duct to release the fluid and wash the eyes. Yes.
Can it be used on children?
It can. This one here is like all eye drops. You know, it stings just a little bit. Now, you're perfectly welcome to try anything that I'm making up here. I'm perfectly comfortable with it. I've done it hundreds of times, and there's no record of any adverse side effects, except you learn obedience from the things which you suffer. So sometimes it gives a little sting, you know, and that's all right, because sometimes the Father had to whip us a little bit to make us obedient, so we won't do it again. Yes.
When you drop it in, is it right in here, or?
Just hold your eyes up and drop it right in your eyes.
Eyeball. Okay.
Okay?
Can you use that if you wear contacts?
Well, you should remove the contacts.
But I mean, it doesn't
Yes.
affect.
No, it doesn't, it will not affect that. Okay, now, what, yes ma'am.
Where do you get the glycerin?
You can buy it at a health food store.
Pharmacy.
Yeah. Okay, I'll tell you what, the next one I'm going to make, and like I said, I've got quite a few, I'm going to try to get through. This one here would be a cough syrup, and what I'm going to do is, I'll tell you the ingredients in it as I go through. This cough syrup here this is horseradish root. Now, horseradish is very powerful. I mean, if you think about how powerful garlic is, well, horseradish is like 2 to 3 times stronger than garlic. But you don't want to get the horseradish in the jar with the vinegar in it. Get the root, peel it, and chop it up. And I'm really going to want someone to test this out for me. But I'll try to get it where most of you can see what I'm doing. About 3 ounces of horseradish root. Now, I'll tell you what, you know, I could probably do this a lot better if I had someone to help me. If someone like to come up, I mean, I'm going to pull this table back. You can come up around here. And I'll probably use someone else, because I'm going to go through these real fast. I want you to put the horseradish, and I'm going to tell you what to do.
Okay.
Put the horseradish in there. Can I get another person? Now, what I want you to do is to take 2 people. I want someone to sit in the chair right here, and you stay down here.
Stay down.
I want someone to sit in the chair. I want someone to give a treatment. Okay? This will be a Cabbage Poultice treatment for anybody have any type of inflammation. Okay, you go ahead on, put that in there and squeeze about 3 lemons in there if you can. Those are pretty big lemons. Probably about 2 would probably be okay. What you will do is you're going to bruise these leaves. Let's see, can I get you something deeper? Okay, well, you're going to have to do it right there.
Should I just do it right here?
Just try not to let me do it like this.
Should I use it like that?
Yeah, just, I didn't want you to cut your hand. Okay. Now, she had to beat up on those cabbage to bruise them because it has oxidizing enzymes in them. And you want to release the oxidizing enzymes because that's what pulls out the inflammation. Okay? The cabbage is very high in oxidizing enzymes. So she's beating it up pretty good. With you, what I want you to do is to put it, because we're going to have to use this blender for this here. Yeah. Okay, now, what we're going to do, now normally what I like to do is get a cabbage with the big leaves. So you can pull them off and they won't break all the pieces. And it's a lot easier to apply. But because it's like that, now normally I wouldn't do this, but I would like to put it directly up on the leaves, but I'm going to do it like this so it makes it a lot easier for her to apply this here. And you're going to apply that. Let me do it like this here. And you're gonna take that and lay that on her arm, or anywhere on her arm there. Okay? And I'll come down and help you with that. Okay, now let's say if she had inflammatory muscles, arthritic pain, anything that is muscle strain, or any pain. So we're going to wrap that. Now this is a real old-fashioned remedy that a lot of people are aware of. It is fantastic that people want to put on their knee. Okay, now you can continue to wrap that a couple more times. And what you want to do is to take it and kind of turn it like that to get the corners. Keep the air out. Then you get around here, you twist it again, and you twist that. There you go. And so this is what we call a soft cast. If a person has broken a bone, you can actually set the bone and do a soft cast the same way. And this will, it will stay on quite secure overnight. That should be about good right there. It's not too tight. Now, this is a fantastic treatment here. I challenge you to try this treatment. If you have any pain in your knees or muscle pain, any kind of muscle strain, wherever it is, wrap it like that. What is going to happen is your body will generate the heat from deep down in the muscles, and the heat will radiate outward. And so it's going to heat up, and as it radiates the heat outward, it's pulling the inflammation out right with it. So it's just a cabbage poultice. Normally we take about 4 big leaves of a cabbage, bruise 4 big leaves, real good, lay them on top of each other and wrap them like this. Okay, let me get back up. Now answer your question. You can take that off. Take it out. Okay, yes.
How long do you leave it on?
I like to leave it on all night, at least 5 hours, you know, before it really works real good. Okay, with you, we're going to put all this in the blender. I do not know how to open this.
Is the handle straight up and it comes back? Is that a click?
Okay.
Do you have to wrap the cabbage in a paper towel?
No,
Can you put
it needs to be directly on the skin, but because these leaves was tore all the pieces, it was going to be hard to put it on. Now, I like to put it directly on the skin.
Are these, I have a question, are these remedies you're using now in God's medical kit?
It is. It's all in God's medical kit. Okay, now for this here, put about a cup of honey in that. And one of those paper cups right there. Well, yeah, I can still use it, but I tell you what, you stay down there. We're going to do another one since you're so good at wrapping that. Okay? I want you to take this, and you want you to get someone else to come back up. And you put that in. And then I want you to take a half a teaspoon of cayenne pepper and put it in there. And then about, well, we got peppermint over this peppermint. Put about 4 or 5 drops of peppermint in there. And I'll go back over that once you get that started. Okay, now let's say that she has a laceration. I had a young man who was cutting with a chainsaw. He came down and hit his knee across his leg with a chainsaw. And they brought him to the clinic. And I did this very treatment I'm going to do here. This treatment is really good, especially if you have an open laceration and you don't want stitches. If you do this treatment right, on time, you will not need stitches at all. It's really powerful with the enzymes that's in this grapefruit. So what we do with that is, let's wait just a minute. Let me have that piece of grapefruit right there. I'm going to take the meat out of it. Now, normally what I would do is I would take this meat of the grapefruit and I would put this in a pot of hot boiling water. You hold that open right there. Then I would put probably about a cup to a cup and a half of Epsom salt in the water, enough water to boil the grapefruit and hot boiling water. And it will saturate the meat of the grapefruit. Then I would take the meat of the grapefruit out. And it's going to be warm when you do it. And now what you're going to do is we're going to apply that, say, on her arm. Okay. Yep. Okay. I tell you what. Let me do it now. That's okay. All right. No, that's all right. And it's basically the same process. This could be on a knee, it can be anywhere on her body. Okay, you got it. And you wrap that real good because you want to secure the heat. And okay, that should be good. Is that too tight?
Hot.
Okay, that should be fine. You can. Okay, like once again, now what this will do, when you cut yourself, you have a laceration. You're open like this. The wound is open. Your body automatically starts secreting a mucus, and it's a sticky type mucus, and it's designed to glue the tissue back together. But what happens is when you cut yourself, you don't do anything. You let the swelling set in, and it stays open, so the tissue can't touch. But if you apply this, especially I would apply ice first, then I would put this treatment on. It causes the tissue to touch. The grapefruit would draw the tissue back together, and the mucus that is secreted by the open wound will glue the tissue back together again. Okay? Yes?
Did you add water when you were...
I did. You take a half of a grapefruit, depending on the area you're working with, and you take about a cup to a cup and a half of Epsom salt and enough water to just kind of boil it a little in the water. And then you take it out and you apply it over the area where the laceration is, and then you wrap that while it's still warm. Leave that on overnight. And it's fantastic because really all it's doing is it's just closing the wound up so that your body natural glue will glue the wound back together again. The main thing is don't let it swell. When it swells, then you got to worry about getting the swelling down before it will actually glue back together. And it will do it overnight. Overnight, the wound will close back up and you will not need stitches.
Amen.
Okay, now we're going to finish the coaster. We've been on it for a little bit. And she did about a cup of honey. And let's go with the onion. Pretty much, yeah, it's going to probably go with all of that. 1 small onion. And I think we already have the garlic. Let's see. So we did about a cup of honey, about 3 ounces of horseradish root, about 4 or 5 drops of peppermint extract, and I think you put about 3 lemons in there. 2.5. 2.5. Okay, now, and also the garlic. I'm putting 1 foot of garlic in it. This is a fantastic cough syrup here, and in the climate you're living in, this is going to be a real valuable one because it helps pull the mucus out, and it opens up your sinus cavity. Any type of bronchial spasms, respiratory failure, this is fantastic for that, to get you back breathing and respirating right. And after we finish, I'm gonna let someone test this. I'm gonna make it probably about 2 or 3 different cough syrups. Because I can notice we got a couple of them, we get different types. But like I said, this is for colds, flus, asthma, bronchitis, any type of respiratory problem where you need to get a person back breathing, you need to get that mucus up out of the system. Just like I hear a little mucus going on right now. We need to get that mucus on out, cough it on out, bring it on out, and that's what you want, because if you keep it in, it will cause bronchial spasms, and eventually somewhere down the line you're going to have a cold mucus or something. But if you get it on out, you find that you'll recover much faster.
Whoever coughed has to taste the cough.
And like I say, now if you're making it for a child, just remember they're not going to like the cayenne pepper. So just kind of either eliminate the cayenne because they won't take that too well. Okay? That's it.
Did you say how much cayenne?
I can put a half. Now, if you're working with a diabetic and you can't use honey, use agave, a stevia, and that will not raise up their blood sugar level.
I have a question for you.
Yes.
When you have chronic lung problems, does this help?
This will help tremendous. I can tell you that right now. I work with a lot of bronchitis, a lot of respiratory failure, and this is what I give them. I want you to try it, and you tell me. We're going to. I think it's all right. Let's do some of these little cups here. Okay. Well, you can put it in there, and I can use the blender with something else. Just a little bit, okay? Okay. Okay, yes, this lady right here on the front seat, she wants to try it.
If it's too thick, do you add something else to it? If it gets too thick?
Well, you can add more honey to it. If you're using agave, you can use agave a little bit more. Yeah, that's a little too much. Okay, now I'm telling you, it's strong. It is very strong.
Could I make it without cayenne?
Yes, you could. But the cayenne just helps you to be able to get it in circulation. But the cayenne is too hot, just cut back on the cayenne. But can you feel it going through your system?
I have one swallow. It opens your nose and all.
What's that? Sinus, bronchitis, anything, any type of respiratory problem. Like I said, the cayenne, you can cut back, eliminate the cayenne, but the cayenne is very valuable because you put the components in circulation. And you want it to go to the respiratory, you want it to go to your lungs. And so the cayenne is going to have a little kick to it because you want to get it into circulation. Okay? Uh-huh.
Can it heal continuing infection that somebody gets?
Well, now, all it's going to do is to help open up your bronchi. It will bring all that mucus and stuff out, make you cough it up, loosen it up. But if you've got an infection, then you're going to have to take some echinacea, a little golden seal, put it into the cough syrup.
And that's all in that.
Yeah, I have about 6 or 7 different ones in there, yes. Okay? All right. Let's see, let's make any questions on the cough syrup?
How long does it last?
How much you take?
How much you take? About a half a teaspoon 3 or 4 times a day.
How long does it last? Like
Till you come down here, we're going to. It will last a long time. I mean, you don't have to refrigerate it because the honey serves as a preservative, so it will not go bad. Okay, now let's say if a person has had a severe brain injury, or has a brain tumor, and one of the most dangerous aspects of brain cancer is when the brain swells. When the brain swells, that person is in a lot of trouble. And so the big key is try to keep the swelling down. And then you can prolong that person's life long enough where you can actually work to try to remove the tumor. If they have a brain tumor, you want to put them on asparagus. You want to let them eat about 3 ounces of asparagus every day for about 21 to 60 days. The enzymes in asparagus help break down the tumor mass in the brain. But this treatment I'm going to do today is to show how to reduce the pressure, because that will be the most dangerous element that you will be confronted with. This is tofu. I know most of you know tofu from eating, but this is a tofu poultice. And it's one that I value a lot because I worked with a young man in Vancouver that had been his head was ran over, and his brain was swelling. And they had him in the trauma center, and they would not let me do any treatment except touch therapy. That means I could rub him, I could pray over him, that's it. But his family checked him out of the hospital because he was going to die. And when he came home, I told him I want to try the tofu poultice. And that's what we did. So I'm going to do that, show you how we did that. And, okay, now you can just mash that tofu up right in there. And now what, I'm going to go through the ingredients in it, and we have 1 block of tofu. And we're going to take about 2 ounces, between 2 to 3 ounces of flour, any type of bread flour. And you can just guess at that, yeah, just dump, that's what I do. And you just mix all that up and let it go. Okay, maybe you put a little more in there. Now, also, we need to put some garlic in there. And our blender is it ready? Okay. You can get that out with this. And the also, you can take this here, the ginger. So you're going to take about 1 bulb of garlic and probably about 2 ounces of ginger. And you have to work with this tofu to kind of work up the gluten a little in the flour. And you can see I'm kind of working with it a little bit. Because I got a purpose, I want to beat up that gluten. So you see that. Yes, I want you to blend that. Okay, this is the texture I want it to be. You see that right there? Now, I used to develop food products for large, major health food industries. And I can't cook a tap, I really can't. And I tell people that, I can't cook anything, but I know how to design the foods to mimic how it's supposed to taste. And that was my job, to try to do that. Okay. And So we're going to mix this right in with our tofu. No, it's good. It's good. That's good. All right. Okay, so we put the ginger, garlic, and flour and a block of tofu together, and we blend all that up together. And what we're going to do now is to, this is a cheesecloth. And let's see here. I probably don't need all of this, but I don't. Okay, so we take our cheesecloth. And we take our tofu. And you're going to make a tofu poultice or tofu plaster. And you see that right there. What you want to do is put that in the freezer and freeze that almost. You don't want to freeze it till it's hard, but you want to freeze it till it's almost frozen. And then when you take that out, boy, I sure would love to demonstrate that, but I won't mess about his hair. But this is a really good treatment here. And what you have to do is to apply this over a person's head. And then you wrap it, do a hip bandage on it. It works, I'm telling you, it will bring the pressure down. Now they used to, in the trauma center, when a person had a brain injury, they used to pack their head in ice. They don't do that anymore. But what we do is we make a tofu poultice like this, and we take some DMSO, and we massage the head first with olive oil. And if a woman has long hair, you cut it down some. And you saturate the scalp real good with olive oil. Then you sponge DMSO on top of the head. Then you take this tofu plaster and just lay it up on the head. You just put it up there like that. You put it up like that. And then you wrap it. And you leave that on. And see, I can feel it. It's cold on my head right now. And I leave that on overnight, and it will bring the pressure down. Fantastic. I really like this treatment. It may seem simple to you, but it works fantastic for reducing the pressure of a brain injury.
What happened to the guy who went from out of the hospital that you used that on?
I was able to take the pressure down. I took the pressure down, and he can't walk too good. I mean, I didn't solve all those problems, but it did save his life.
Oh.
It did. That's been many years ago, but I know I stayed in contact with him for many years, and he was still living. But it took the pressure down. You can tell when the pressure is building, the eyes are crossed. When the eyes cross, then the pressure is extremely high. Okay, now the next thing we're going to do is, we'll take a lemon. And another, we have another person want to, now I'm going to tell you before you volunteer, now this is to how to remove cataracts. I'll put one drop of lemon juice in your eyes. Okay. All right? Now, let me let you know something. It's going to sting a little bit. But that's all right, right? Well, I mean, women have tried. I mean, it's no problem with them. I'm going to tell you, because women can deal with pain. And I'm going to tell you something. Us brothers, I always have sisters, they don't shy away from pain. But brothers, we can't handle no pain. I'm telling you. Okay, now, it's just one drop. You hold her head back and you put one drop. Try to get one drop in the eye.
Oh, with the lemon.
Does that remove them?
It will, what it does, it will dissolve the plaque in the duct, and which will let the fluid, the tear ducts. It's going to stimulate the tear ducts. You'll see what I'm talking about. Well, she's tough. She was able to take it without jumping around.
She didn't plant.
I was told I'm at stage 2. I might have to have surgery in a year or so for cataracts.
Well, she's tough. You see how she handles that.
Burns, but
Now, it's going to stimulate her tear ducts. And the tears, she's going to start crying. It'll start coming down, but that's what you want. The magic bullet is in the tear duct. It's not in the lemon, it's in the tear duct. God put enzymes in the tear duct to dissolve the cataract and up under the lens. But because a lot of us suffer from dry eye, a lack of circulation to the eyes, I will build a natural protection called a cataract. You remember Paul on this road to Damascus. You remember he had an encounter with a bright light. And it was so bright that it knocked him to the ground. And when he got up, he was blind. And then he remained blind until he met Ananias, and he prayed over him, and the scales fell from his eyes. Those scales was cataracts. Okay? There was cataracts. Okay, now, I'll tell you, it's going to start feeling real good in a minute here. Her eyes will turn red, but eventually they're going to clear up, and she'll be able to see a little better. And when the burning stops, it's a nice, calm, soothing feeling will come after that. So it really is. It feels really good after the burning stops.
How often do you do that?
You do lemon in the morning, honey at night. 1 drop of honey at night. Okay? You do that for 21 days.
Now, would that work in the same effect as eye bright tincture?
It's actually very similar to it. It's a lot cheaper.
Right.
No, but yeah, it is very similar to eye bright.
So it'd be doing the same exact thing then?
Yeah, it's pretty much the same thing as eye bright. It's just a cheaper way of doing it.
it's okay. It's just the lights bothering me when I open them. The light.
Okay, now we're going to show you how to stop a heart attack in 30 seconds. Okay, put about half an ounce of water in there. Now I took about 1/3 of a teaspoon of cayenne pepper, 1/3 of a teaspoon of cayenne pepper, and I'm going to tell you now, if a person started having a heart attack, you need to stop it. I started having angina pains. This will stop it. The angina pains and the heart attack in 30 seconds. It's faster than nitroglycerin. I know you don't believe that, but it really is. Now, if a person has tightness in the chest, give them this product right here. Now, if somebody's courageous enough to try it, we'll demonstrate it. Okay, now I'm going to try it on the little young people. I'm not going to do that. And I'm sure they're tough enough to do it, but if someone wants, I'm going to tell you how to drink it so it won't be so hot in your mouth. The taste buds on your tongue is real sensitive on the front side of your tongue. You do not have any taste buds in the back of your tongue. You don't have
Want to try it?
it. Okay?
You want it under his tongue, right?
What he's got to do is lick his tongue out, put the cup on top of his tongue, and throw it in the back of his mouth to bypass the tip of his tongue. And it won't holler about burning at all. Yeah. Well, he kind of slushed around his mouth a little bit, so it's going to be a little hot on him. So let's get him a little water here.
His face is turning red.
But, oh, he has some.
Okay.
Now, I'm going to ask him, as he gives him a drink of water, I'm going to ask him, where did he feel that cayenne pepper? Where about? Where? Where do you feel it at? Anywhere else?
And the top of my throat.
Okay, you don't feel it nowhere else? Not in your chest, not in your head?
A little bit.
In your head. Eventually, if you start feeling it going up to your head, that means that there is a weak spot there. If you feel it in your chest, that the weak spot is there. If you feel it in your stomach, there's a weak spot. Cayenne is a catalyst. It goes where the weak spot's at. If you start feeling it in your head, that means that your major arteries run up from your heart to your brain may have a little plaque in it. It may have a little plaque, and you're not getting enough oxygen to the brain. This is where people, 90% of the people that are diagnosed with Alzheimer's is false diagnosis. It is plaque buildup in the arteries.
So that cure Alzheimer's?
What you want to do is to clean out those arteries. The more oxygen you get to the brain, the better your brain going to function. It's kind of like an alcoholic. He drinks alcohol, he robs the oxygen from his brain. He can't think clearly. It's a person that overeat, eat too much food. They get sleepy and drowsy because it competes for the oxygen. So the more oxygen your brain gets, the clearer you'll think. So if you got plaque on those arteries, that means it's hindering the blood flow, because when the blood leaves the heart, the first place it goes to your brain. When he drank that cayenne pepper, it went into circulation, went to his heart, and it shot that cayenne right up to the brain. Then the brain is supposed to take it back down to the rest of the body. If you feel it a little warm up here, that may be a key. If it gets hot in your chest, that means you may have some cardiovascular problems. If it's hot in the stomach, you may have some gastric problems. What that tells you is that I need to work on those things. Okay? Any questions on that? Yes, in the corner here.
How often do you do that when you're saying, does that one time remove that plaque?
No, it don't. Let's say he did have a cardiovascular problem, like some blocked arteries. Well, he's going to have to do that for a period of time. And natural remedies don't go by a time period. They don't work by time. It works on the person's body. It works on how faithful he's able to follow. But what it will do, it will take blood, help the blood circulate in the body so that he won't have a major heart attack. And that's what the problem is. With a heart attack, the blood is flowing and it hit a blockage and the blood bags up. It bags up like that. Every time it bags up, you get a pain. You get angina pain. Until finally, it can work its way through and you get some ease. What the cayenne pepper do, it thins the blood out so that when it hit it, it don't have that backflow. It go right on through it. And so it can lessen the bagging up of the blood in the cardiovascular system. Yes.
So that repeat and repeat, does that eventually stop that going to that area then?
What that will do is, basically what this will do is just stop him from having a crisis. It will not correct his problem. But now, if he have a problem with blocked arteries, what he want to do is to eat 2 of these here every day for 30 days. And over 60% of his arteries will open back up. Now, the problem is, if he's on high blood pressure medicine, they advise you not to eat this grapefruit. But the grapefruit has some citric acids and other enzymes in it that emulsifies fat. The way it works is, you see these commercials on TV where they have these greasy pots and they stick it down in this soapy water and they pull it out and it's clean? They call it OxyClean. Well, OxyClean is nothing but fortified with citric acids. It is the citric acids that breaks down the fat globules that cleans that grease off those pots. Well, the same citric acid and other enzymes in this grapefruit, once it's get into circulation, will emulsify the fat and plaque in your arteries and clean your arteries out. So if you're taking blood pressure medicine, you know, follow your doctor's advice. But if you really want to get what we call a natural chelation therapy, eat 2 grapefruits a day and that'll clean your arteries out.
If you have high blood pressure, aren't you supposed to eat grapefruit?
You shouldn't, I mean, doctors tell you not to take grapefruit if you're on high blood pressure medicine. Now, what it is, the grapefruit do not like your blood pressure medicine. They like you, but they don't care much for your blood pressure medicine. So it interferes with your blood pressure medicine from working effectively. And that's the only reason why they said don't take it. But now if you're on blood pressure medicine and you want to get off of it, then you take this enema bag and a bulb of garlic. You blend this up in this whole blender full of water, this whole bug, and then you put about 3 to 4 ounces of garlic tea in this bag right here, and you simply give a person about a 2-ounce garlic retention enema. Did everyone get that? Take a whole bulb of garlic, blend it up, fill the blend up with water, put 2 to 3 ounces of garlic tea in the enema bag, lubricate the tip, insert that in the rectum, let about 2 ounces, no more than 3, 2 ounces of garlic tea slowly come into the rectum. What happens is, when the garlic gets into the rectum, your portal veins in your rectum absorbs the garlic. Garlic is a solvent. You can take garlic and rub it on the bottom of your feet and you can taste it on your tongue. Because it's a solvent. So the minute you drink, you put it in your rectum, the portal veins absorbs the garlic, sends it to your liver. Your liver sends it out into the circulation. Take your blood pressure immediately down. And it will do it quick. And in a few minutes your blood pressure will drop a sizable amount. Now if your blood pressure is 200 over 170, that means you may do 2 or 3 of these to get it down on a safe level. But you do it, you check your blood pressure, you say, well, it did, it went down 20, 30 points. Do it again. Bring it down another 20, 30 points. You do it until you get it down. Okay, at the same token, if your head is pounding and pounding, give this garlic enema, give a person a hot foot bath, put a cold compress on the head over the heart, give this to them, and they won't have a stroke. You'll stop them from having a stroke or a heart attack. Any questions on that?
Is that in the book?
It is in the book. Yes, it is. It is in the book. Now, since I'm talking about the garlic, you take this garlic bulb and you chop this up, put it in the blender, blend it up to a thick cream, and you smear this on a piece of cotton cloth, and you lay that on your kneecap. Just lay that on your kneecap and wrap that the way you see I was wrapping those other and other poultice. You leave that on for 6 hours. It's going to put big blisters all over your kneecap. It's going to make it look like a 3rd-degree burn. Now, if you're diabetic, you cannot do this treatment. But if you are scheduled for a knee replacement, it's going to put real large blisters, almost as big as this garlic bud. You take a sterilized needle and you prick those blisters and let that fluid drain out. By the time you drain all that fluid out, inflammation will be gone. Then you take this plant right here, this aloe vera plant. I'm not going to pick it up, but you take this. You take this plant right here, this aloe vera plant, and what you want to do is you want to cut it open, and let's see here. You cut it open, and I'm just going to cut it. And I always like to split it open. This is a little bitty plant. And then what you want to do is to take this juice and cover the blisters, where the blisters was, real good with this aloe juice. And you try not to wrap it up. If you cover it, leave it loosely wrapped. And also, if you don't have aloe, you can use honey. Take honey. Pour honey on top of it. A good thing is to use honey and turmeric. Take 2 ounces of honey, 2 ounces of turmeric powder, makes it real good, and cover those blisters. The blisters will heal up and won't even leave a scar behind. Do not use this treatment on any diabetic person that you cannot produce a blister. Yes.
Now, is that just a short-term thing, or will that actually feel the need?
This will actually correct the pain, the inflammation. The problem with people with arthritic knee is the inflammation and fluid buildup in it. What this will do is remove the fluid. The fluid contains the inflammation. The only reason why you have fluid is because you had inflammation. And so by pulling the fluid off, you pull the inflammation off. It will not correct your knee, but it removes the inflammation. And now you must make some lifestyle changes that would help you rebuild a healthy kneecap with collagens and everything in it. But basically all it's going to do is just take the pain and inflammation away. Yes?
That works the same on the elbow, rotary cup up here, any that type of thing?
Yes, it does. Now, it don't work with bursitis. Bursitis is a different type of arthritic condition. But any other type of arthritic condition, it will work. Okay.
Dave,
Yes.
now, I have a little bit like a heartburn.
Okay. Now, you feel it in the chest. You feel it kind of in the chest area?
Yeah, right around here,
Yeah.
like a little heartburn.
That's right. That's where it's set. It's finding those weak spots. And so, you know, but if I was you, I would get on this product right here. I would get on, now the doctors may have you on an aspirin a day, a baby aspirin a day, but actually the white willow bark is what they make the aspirin out of. They make the aspirin out of the white willow bark, but they put a lot of chemicals in it. I would take the cayenne pepper, white willow bark, and ginger. If you take ginger, equal parts, ginger, white willow bark, and cayenne pepper, it is better than any aspirin you can take. To keep your blood thin and keep it from having a blood clot.